Welcome everyone, and thank you for joining this webinar. This is the first of a discussion series on outbreak preparedness and response. The aim of the series is to provide opportunities for sharing learning, ideas, and resources on outbreak preparedness and response. Today's webinar will focus on educational programs aimed at supporting disease outbreak preparedness and response. We will have 3 short presentations followed by some time for discussion. We hope that this will be an opportunity for sharing of experiences and reflections, and so we encourage you to really feel free during the discussion. We'll start first with a quick poll, just to get an impression of where everybody is. We'll just give a few moments for everybody to complete the poll. Looks like we've had most of the responses now, and we're just sharing the results. And it's great to see that we've got people from right across the globe, and a pretty kind of well-spread representation. So lovely, lovely to have you all here. I'm not surprised we don't have anyone from Antarctica. It's good to know. Great. All right. So thank you so much for completing that. And great to be seeing all the chat that's coming in and people introducing themselves in the chat. Please feel free to keep doing that as we go through. So the first presentation today will be by myself. So I'm going to just share my screen. Apologies, I've just realized I didn't actually introduce myself. My name is Mary and I work for a team called the UK Public Health Rapid Support Team. And I'm going to be sharing our experience with developing the massive open online course titled COVID-19 Tackling the Novel Coronavirus. The course was aimed at supporting efforts to counteract the spread of misinformation around the novel coronavirus. The target audience was really anyone who was interested in this topic. And I think we can all agree that that was pretty much everybody. The rapid support team, the UK Public Health Rapid Support Team, developed this course on behalf of the London School of Hygiene and Tropical Medicine. The course was developed over 6 weeks and started by us developing a very focused working group made up of individuals who had prior experience with developing MOOCs on disease outbreaks, individuals with public health and pedagogy expertise also. We really had a very broad range of contributors. To give an example, we had contributions from the WHO, from Africa CDC, from the University of Hong Kong, just to name a few. We were really, we felt it was very, very important to make sure we had this broad range of contributions because we understood that the topic was going to be globally applicable. Equally on that point of the topic, we also felt that a social constructivist approach was best because it's one that really facilitates discussion, sharing of perspectives, developing of new ideas on a topic. And I'm more than happy to pick up on that point of the social constructivist approach a bit more in the discussion if it's helpful. The course itself lasted 3 weeks. The first week was designed to describe how COVID-19 emerged and was identified. The second week then looked to appraise the public health measures for COVID-19 worldwide. And the third week was more of a look forward to evaluate what is needed to inform measures going forward. We did our best to use a broad range of different formats, quizzes, audios, videos, to try to speak to a broad range of different learning styles. And wherever possible, we included these additional learning resources which linked you to sites, trusted sites that was providing up-to-date information on the disease outbreak. So the first course has now been run twice, and the first iteration of the course opened on the 23rd of March last year. When we opened, we already knew that we had over 100,000 people enrolled to take this course. And we quickly realized that we were really going to need quite a machinery, quite a lot of effort in order to be able to manage the course discussions. So what we did is we developed a systematic approach to managing those course discussions, which again, I can talk to a bit more in the discussion if helpful. The discussions that were seen on the course were really quite something. There was so much peer interaction, lots of people sharing ideas from lots of different parts of the world, and a real sense of building a global community. We translated the course or contents of the course into 7 languages which were available over these 3 weeks. We actually started with 5 languages, and based on feedback from participants during the course, we translated into a further 2 languages. And the course remained open for 6 weeks after its 3-week facilitated course run. And during that 6-week time, we updated the course. And that update was largely informed by feedback that we got from the London School of Hygiene and Tropical Medicine Centre of Excellence in Teaching and Learning. We were fortunate to have members of that centre take the course as participants, so they could give us feedback of what it was like to be a participant on the course. And a particular bit of feedback that they gave us, which we found very helpful, was to start by having each of the steps have a question that the learners could reflect on as they read or watched or listened to the material of that step, and then to repeat that same question at the beginning of the discussion sections, really giving learners the same question to reflect on and facilitate discussion on a particular point. It was difficult to update the course because at that time we were really in the throes of lockdown. And so we had lots of logistical issues, but we managed, and we managed to update every single step on the course. We also added additional steps on Europe, fragile contexts, and social and political issues that were really coming to the surface around that time. And lastly, we added an animation, which you can see a small image of here. The animation was designed to support those who needed to explain COVID-19 to children. And I'm hoping that a link to the animation has just gone in the chat for anyone who wants to look at that a bit later on. The second iteration of the course then started on the 25th of May. And a lot of the learners from the first course returned for the second course, which was quite nice. It also helped with the discussions because now we could see that discussions were much deeper. There was much more interaction between the learners and a lot more reflective style to the comments. The second course also ran for 3 weeks as a facilitated course, but then remained open for several months up until the end of September. And again, we emphasized these additional resources which linked to trusted sites that were updating in real time, so that even after the course closed, learners could hopefully have sites that they could go to where they could rely on the information that we're getting. Again, looking at that thing of addressing misconceptions, misinformation. I've already alluded to the fact that we had quite a high enrollment for these courses. The first run at the end had 200,000 learners enrolled from 186 out of 195 countries, and over 80,000 comments posted. The second course, fewer enrollments, around 30,000 from us, 160 countries, and naturally fewer comments, but as I mentioned, kind of a richer sense to those comments and those discussions for the second course. We also saw that the course was taken up by a number of medical schools and incorporated into their medical school curricula, and the course was also used by the the African Health Volunteers Corps as part of their pre-deployment training. We have been looking at student experience on this course quite a bit in order to inform what we do in the future. And the post-course survey is showing that there was quite good engagement and experience for this course, most stating that they felt that the course either met or exceeded their expectations. Equally, that they gained new knowledge, but more importantly for us, that they have applied the knowledge and shared that knowledge with others. We also found that the course was picked up by a number of different media outlets. What was interesting here was how we could see some of the terminology that we were using on the course now reflected in the ways in which COVID-19 was being reported. So specific terms that we were using now appearing on kind of common media. And that was quite helpful again because of our aim being to kind of shift the way in which the reporting was being given for COVID-19 to address that thing of misinformation. So really it's just to say that we think that MOOCs have a role in supporting learning during disease outbreaks, in that it supports a type of deeper learning that maybe we don't have from your traditional messaging like posters and so on that we're more kind of used to when it comes to disease outbreaks. We're currently just finalizing some research that looks into exactly what it is that we did for this MOOC, with the aim of putting together a framework for the development of MOOCs as part of outbreak response in the future, so that we don't have to reinvent the wheel, so that someone else can pick up that framework and put together a similar course if they wish to do so going forward. Actually, I was not alone in doing this, and it was a really massive team of people involved in pulling this together. And this is just to give a small snapshot of that and to say thank you so much. We will now just move on to our second presentation. Our next speaker is Renata. Renata is a public health researcher working for Oswaldo Cruz Foundation, also known as Fiocruz. She has a master's in public health policy. Her main research interests include digital health, health professions workforce, health education, and vulnerabilities in health. She has been working in the field of public health for over a decade and has co-authored the Fiocruz online course on COVID-19 management for health professionals, which is the basis of our presentation today. Over to you, Renata.
Oh yeah, thank you, Mary. Good morning from Brazil here, and good afternoon to you all. Yeah, I'm going to talk a bit about our experience in this course development process, emphasizing mainly the why of the course, the challenge faced, the results obtained so far, and some final remarks. So the first confirmed death of COVID-19 in Brazil was on March 17th. It was just beginning the number of confirmed cases. We were just watching the number of cases increase all over the world and no longer just in China. At the end of April, we had an average of more than 5,000 cases per day, and we witnessed the exponential increase in deaths. Brazil is an unequal country, but we have a national public health system, and in a pandemic context, information is produced daily, it's sparse, and we need to keep the population and especially health professionals informed and up to date. And Fiocruz, as one of the main public health education and research institutions here in Brazil, had a duty to develop educational and informational contents on the pandemic that had just arrived. Um, so developing this course was not an easy task. The team first met at the end of March when we decided that we should join forces to inform and raise awareness about COVID-19 with focus on health professionals. And I believe we can highlight three main difficulties. And it was about 2 months of intense work with difficulties, firstly, in finding information as it was an entirely new disease and evidences were being produced every day. And here the guidelines were changing all the time. There was also the urgency to finish the course, given the aim of informing and training people and health professionals. Besides, another difficulty was to gather a team of specialists that was available since here health specialists from Fiocruz were mobilized in work fronts in hospitals and healthcare. And finally, I believe that working intensively on COVID-19 at the same time receiving so much information about the victims of the disease was a very stressful job and quite exhausting for the mental health of the team. And how we did it. This is the course. Um, the team was made up of specialists in health and education, as well as graphic designers and information technology professionals. The course structure was developed and topics and content were defined. And in addition, we thought about agile and alternative content. We all work remotely for sure in our homes, and the whole process lasted about 2 months between April and May, and the course was launched at the beginning of June. It was one of the first courses developed and released here in Brazil, and um, current, currently the course is being updated, and the big news regarding the content is the discovery and development of the vaccine. And we also have a new course on vaccine that has been launched too. So the course COVID-19 Management of Infection Caused by the New Coronavirus, em português is COVID-19, Manejo da Infecção Causada pelo Novo Coronavírus, is an online, open, and self-paced course in Portuguese, and its structure was organized in 3 modules, and each model has a specific hours, like spending hours. The first one is an introduction model that concepts and basic information. The second model is about clinical management on primary health care. And the third one is also clinical management, but in severe cases. Um, we have the course reached the 30,000 mark in the first 2 months. By last March, we had more than 56,000 students enrolled in over 3,000 cities here in the 27 states of Brazil. and 44 other countries around the world. And here in Brazil, of this total, almost 25% are students from Rio de Janeiro, where Fiocruz is based. And we saw that the capitals and large cities had higher rates of enrolled students, and the south and southeast regions of Brazil, considered the hub of greater economic development, had the most students enrolled. But although these regions had higher absolute numbers, the regions with less economic development, like Northeast and Center-West, had higher relative percentages of enrolled professionals. And among these enrolled students, almost 20,000 are nurses, between nurses, practitioners, and nurse assistants. And the total number of physicians enrolled is almost 5,000, and community health workers are almost 1,000. So final remarks. I think we can, I believe we can think about proposing common platform sharing educational materials to facilitate quick access to information and data produced beyond strictly scientific platforms. And I also believe that we should focus on regions with lower economic development, because as seen here and in our course and supported by the scientific literature, these are the regions that show the greatest demand for training, it's especially in this course format. And in all countries other than Brazil, the profile of students is made up of Latin speakers. So I think it's important, our course is an important key to non-English speakers. Yeah, so I think we can now discuss on the time for it. And I would like to say thank you for you all. Yeah, that's it.
Thank you very much, Renata. Lovely, lovely presentation. And as I mentioned earlier, we can take questions for Renata's presentation or any comments once we've had all of our presentations. Our last speaker today is Briëtte de Toit. Briëtte is the training coordinator for the Infection Control Africa Network, also known as ICANN. She has a master's in infection prevention and control and has extensive experience in IPC strategy development, training, quality improvement, and policy development. She has recently been part of a ministerial advisory committee on the prevention of COVID-19 amongst healthcare workers. Briëtte will be presenting on ICANN's training programs with a particular focus on its trainings for Ebola virus disease. Over to you, Briëtte.
Thank you very much, Maryirene, for the introduction and also for the opportunity to be part of this webinar series. As Maryirene said, I'm going to focus on specific aspects related to the Ebola outbreak in 2014 in Sierra Leone. So infectious diseases outbreaks cause millions of deaths throughout the African continent each year. Almost half of African countries experience an emerging or re-emerging infectious disease epidemic each year, of which some have been eradicated in other parts of the world. Africa experienced major challenges with health systems due to inadequate infrastructure and finances, skills gaps, there's no career path for IPC practitioners, and inadequate surveillance resulting in undetected outbreaks. Also inadequate knowledge of communities and healthcare workers, and then a lack of resources, infrastructure challenges, inadequate IPC training, are also contributing to ongoing outbreaks. This is a slide that demonstrates the status of outbreaks in Africa as of the 14th of March, as reported by the WHO. You can see that currently there are 105 outbreaks reported or that has been reported in Africa. So the Infection Control Africa Network, or ICAN, has been established in 2008. It is a not-profit organization which is dedicated to improving IPC in Africa, mainly via training. It is the largest IPC organization in Africa with 550 members from 54 countries. ICAN provides world-class training programs, which has been developed since 2009, first of all in South Africa, and then it has been expanded to other parts of the African continent and also beyond. ICAN trained a total of 2,530 students in IPC from 2015 to 2020. The objectives of ICAN are to, first of all, education, Cape to Cairo education programs in IPC, capacity building and developing of technical skills and mentorship, research, national societies, the establishment of IPC societies in countries in Africa, improving health systems by preventing and reducing transmission of infection, and guideline development in collaboration with the CDC and WHO. ICAN early identified the need for trained IPC practitioners and IPC training in general to ensure that countries are prepared for outbreaks. The Ebola outbreak in West Africa in 2014 further highlighted the need for trained IPC practitioners and is again highlighted now with the COVID-19 pandemic. ICAN developed and support various training programs in response to outbreaks. For example, last year in the Eastern Cape of South Africa, there was a huge COVID-19 outbreak, and ICAN was involved in the training of the healthcare workers. The Ebola outbreak in the DRC in 2018, the plague outbreak in Madagascar in 2017, various healthcare-associated infection outbreaks in South Africa, and ICAN provided support during the 2014-2016 Ebola outbreak in West Africa by conducting the IPC training in collaboration with the WHO, CDC, and the International Organization for Migration in Sierra Leone. And ICAN also developed the Ebola training book in collaboration with Preparedness. So today I'm going to focus specifically on the Ebola outbreak in Sierra Leone in 2014 and the challenges and lessons that were learned. Sierra Leone has a population of 7.8 million people. The GDP per capita is about $528 US. There's 1.4 doctors, nurses, and midwives per 10,000 population. The Ebola virus disease outbreak lasted from 2014 to 2016, and during that time, there was a total of 14,124 suspected, probable, and confirmed cases, 8,700 laboratory confirmed cases, almost 4,000 people died, and then there were 90 healthcare workers that passed away due to Ebola. ICAN was contacted by the WHO in December 2014 to assist with the Ebola outbreak. So here is a timeline of what ICAN did from 2014 to 2017. In January 2015, ICAN sent 4 trainers plus Prof Meta to Sierra Leone and they trained 65 students within a period of 2 weeks on basic IPC principles. During that time, Professor Mehta assisted the Ministry of Health to appoint a national IPC coordinator. In March 2015, another 75 students were trained on basic IPC principles with additional Ebola-specific training. During this time, a facility assessment was also done in various places in Freetown. In October 2015, another 2-week training session with the same group was conducted, and a train-the-trainer component was included, and 30 people were selected to do the train-the-trainer component. And another facility assessment was done. In 2015, ICANN assisted the WHO to deploy 8 IPC practitioners that previously did the postgraduate diploma, the ICANN postgraduate diploma, and they were deployed in Sierra Leone to assist with technical support and with mentorship. In 2016, a national IPC focal person attended the Fundamentals in IPC course in Cape Town, South Africa, and she stayed on another 2 weeks to be mentored by experienced and trained IPC practitioners in Tygerberg Hospital. Then in 2017, a 3-day certification workshop was conducted with some countries from Western Africa, where they were trying to set up a certification for IPC. They were supported by South African and Zimbabwe IPC specialists who already had systems in place. During this time, a post-assessment of the facilities were done, and they found that there was a 30% retaining of knowledge since 2015. In July 2015, ICANN assisted with curriculum development and skills lab development and guidelines, which was approved by the University of Nala and the Nursing School of Sierra Leone, and also the Ministry of Health. In July 2017, the basic IPC and advanced courses were presented again with a TTT, with a train-the-trainer component, and 30 people were selected, who then had to train 10 more people. And from September to October 2017, these 30 people, these 30 students were evaluated, the curriculum that they developed, as well as the training material, and then the 300 people that they trained were also assessed. In total, 500 people were trained during that period. First of all, 175 in 2015, another 30 in 2017, and then the 10 people who trained the additional 300 people each. The training method that was used was face-to-face sessions, small group discussions, lectures followed with practical sessions, and the practical session is a big component of the ICANN training to ensure that there's theoretical-practical integration. There was a pre and post knowledge assessment, facility visits and assessment, and then also the train-the-trainer component. Collaboration, there was collaboration with the CDC, WHO and IOM, Ministries of Health, and universities and nursing schools. The feedback from the training was almost 90% of the attendees said that the training were either very useful or outstanding. And when we looked at the knowledge increase, first of all, the basic course, the knowledge increase that took place was 12%, and with the advanced course, it was 37%. So the challenges that were experienced with the training was, first of all, the previous experience and knowledge. The majority of people that were trained had no previous IPC training or exposure. Very few were trained IPC practitioners. IPC infrastructure was non-existent, and the stigma associated with a lack of knowledge. The language was a barrier because there were different dialects and different accents, and not everybody was fluent in English. Logistics and infrastructure, the classes were very long and lasted past 4 or 5 o'clock in the evening and there was a curfew, so people couldn't use public transport going home and they couldn't buy food. So once that was realized, it could be rectified. And then cultural practices and beliefs, the influence of traditional healers, the cultural beliefs and practices impacting on IPC principles, high superstitious beliefs, and no traditional leaders were involved in the healthcare program development. Lessons learned during this period. First of all, community engagement is extremely important. It's important to involve traditional leaders and the community and the trust of the traditional leaders, and they will influence the communities. Understand and respect cultural habits and religion of local population. Explain and educate the communities. Training, it is extremely important with regards to the training that the persons presenting the training or conducting the training, that they have empathy and insight into the culture and the challenges. The program needs to accommodate religions and different religions and religious days, understand the background of the students, and ensure that the healthcare workers who work with Ebola patients are trained adequately in IPC. Then lastly, collaboration with other groups is extremely important. During this time, there were 30 different organizations providing training. So it is extremely important that the same message is presented to everybody and that the same reference material is used. With regards to the consistent message, it is important that there's no conflicting information provided by different organizations. Then in conclusion, Sierra Leone faced a flare-up of Ebola virus disease in January 2016. The response was, however, shift, and this resulted in containment at the source. The successful response was attributed to improved capacities for building combined with prompt detection and strong coordination in legacy of the previous response. Well-designed and executed IPC training programs is extremely important. Well-trained IPC practitioners, together with ongoing support, mentorship, and technical support, is key to empower communities and have long-lasting results, resulting in sustainable behavioral change. And lastly, just acknowledgement to the ICANN board, Professor Shaheen Mehta and Anna Fondra. Thank you very much.
Thank you very much, Briëtte, for your presentation. Very, very nice. I have a number of questions and things to discuss myself. But I think best that we open it up because I can see a number of queries coming up in the Q&A box, as well as some hands being raised. Just for anyone who joined a little bit late, just going to repeat the instructions for the discussion. So we'll have about 20 minutes now for discussion, and we encourage you to ask questions of the speakers or to share your experience or an idea relating to education in disease outbreaks. We're wanting this to be as much as possible an open discussion on the topic, so feel free to share. As mentioned earlier, you can either raise your hand using the raise hand function if you want to ask your question or make your comment verbally, or you can use the Q&A function, which I can see a lot of you already are using, to post your comment, and I will read those out as we get to them. And lastly, it's just to re-emphasize to anyone who joined late that this is being recorded, so anything you share would be made publicly available. I don't see any hands raised just now, so I'll go to the Q&A box, and I'll just take the questions in the order that they come up. But before I do that, can I just invite my fellow speakers to put their cameras back on? That's lovely. Hi. Thank you very much. Okay, so let's see here now. The first query that I can see here is one that I think is maybe outside of the scope of what we have intended for this course. So it's asking, what are the steps of an outbreak investigation and how should it be controlled? I'm very sorry to say that I think this is broader than what any of us on this panel can discuss. It is something that I know some things about, but I think because we're focusing today on educational programs, it will take us too far off to go down that tangent. But maybe this is something that can come up in a future discussion in this series. So the next one that I can see is about whether there are certified courses. Are there certified courses? Certificates will be provided, any free? I'm guessing here that you're asking whether the courses that we have presented are certified. If that's not the case, then please feel free to raise your hand and come in verbally, or add another question to this Q&A section. But in relation to the course that I mentioned, the massive open online course that I spoke about is no longer available for people to enroll onto. When it was available, there was a certificate that you could get at the end, a certificate of attendance. And in the future, if we were ever to be putting out any other similar courses, there would be a certificate at the end. Briëtte, Renata, can you speak to your courses in terms of certification?
Yeah, can I start? Yes, our course is certificated and it is still open, but it's only in Portuguese until now. But we have a project to translate to English. And it's for free. It's an open course, so with no fee. And yeah, it's certificated from Fiocruz that has a relationship with our Ministry of Health from here, from Brazil. I believe I answered everything.
Apologies, I didn't also address the question about whether there's a fee. So for the MOOC that I spoke about, there is no fee. Typically, the massive open online courses are free. There is sometimes a small fee if you want to have unlimited access to the materials. Is there a fee for your course, Renata? And I believe,
No.
Yeah. And
no,
sorry, go ahead.
Sorry. No, sorry. We have even none of tax or fee, and the access is unlimited. And while the course is online, you can access, and you can download in some specific contents and graphics and tables, and yeah, it's all for free.
And Briëtte, what about your courses, these certificates?
Yeah, so I can offer different courses. There is the basic IPC course, which is a 5-day course, and the successful candidates get a certificate of competence. The price of the course is about 7,000 Rand. And then there's an advanced course, which is a little bit longer. It is 10 days, and I think it's 10,000 Rand. Then there is the Fundamentals in Infection Control course, which is a 6-month course with 5 modules, 3 contact sessions, and it is SAMA, which is the South African Medical Association accredited, and yeah, there are a certain number of CPD points assigned to it, but I can't remember the number of CPD points now. And that is about 17,000 Rand. And then we have a postgraduate diploma in infection control that is presented in collaboration with the University of Radboud in the Netherlands. It's a 2-year course. And then you have a postgraduate diploma in infection control. And the price of that course is about 37,000 Rand.
Okay, thank you so much, Briëtte. And Renata, I see your hand up.
Yeah, because I forgot to say that all the courses offered by Fiocruz are in the same format that is free and open. And in some courses like this about COVID, I would have some keys, some questions to analyze the course and to get the certificate. But you can also do the course without these questions, and so, but you don't get the certificate. Yes, I forgot to say.
Thank you for adding that. And I can see a follow-on question. I believe the initial question was from Bhupinda Bayan. Apologies if I've mispronounced your name, but the follow-on question is asking around whether it's being offered in English. I know that the MOOC I'm talking about is offered in English. Briëtte's courses also offered in English, but I believe, Renata, you had said that your courses were not in English as yet, but there is work to translate them into English. Is that right? Correct. Okay, great. All right, so I will move on. Still not seeing any hands up. So please, just to re-emphasize, if you would like to ask your question verbally, just raise your hand using the raise hand function at the bottom of your screen, and we definitely will come to you. I see John Ungo raising his hand. John, I'll be with you in just a moment. My colleagues Zainab and Poppy might just be in touch, double check that wasn't an accidentally raised hand. So I'll be with you in just a moment if it isn't. We'll just ask very quickly now this question that's in the Q&A that speaks about when do you start the MPH? Lovelyn asking, when do you start the MPH on outbreak preparedness? Lovelyn, I'm guessing this is towards me from a presentation you might have seen me speak about previously. I would say that we don't have a date as yet for the MPH, but please know that as soon as we do, you will be knowing about it, and probably keep an eye on the London School's web pages. That's the London School of Hygiene and Tropical Medicine, because it will be circulated widely. Ladies, that wasn't referring, that doesn't link to your work, does it? No. Okay, so let's, because we have some hands raised, I'll go to John Ungo first. John, your mic unmuted. Please feel free to ask your question.
Yes, thank you for presentation. And my question goes to Renata David. My name is John Hongo. I'm from Kenya. I'm working as a data manager from Kemri in Kenya. So my question goes to Renata David. Okay, I'm just wondering the kind of presentation that you put across, how do you guys intend to escalate this experience and ideas towards here in Africa? And especially my question was going to, how will this correspond to the different changes of COVID? Because you remember the first one, we had COVID-1. Currently, we are having COVID wave 3. You know, it is dynamic. So how do you tailor your experience and response to specific, so that in case of like now we have a COVID wave 3 here in Kenya, we can use your experience to prepare other people's on the response towards COVID, which might mutate in several versions. Thank you.
I'm not sure if I understood all the question, but I think it's about our experience here in Brazil to face the pandemic and all over the changing that is till now. And I think also here we have political problem also, then difficulties the process. And is it right? Yeah.
Yeah. So my question was, okay, how do you intend to use the experience to prepare people? Because your main aim is to prepare people towards the outcome of COVID. Now, how do you intend, despite there is this political and currently now the world has moved into technology where now you can have even a video call to alert people or train people. Now, how do you intend to use this experience and ideas you've gathered to ensure that people are ready to face the challenges towards this kind of COVID mutation?
Yeah, I think our team is producing, like we have a website from Fiocruz and from Campus Virtual, that is the developer of course inside Fiocruz. And we also published our experience there, like telling these steps that we had done the course, and we are preparing also an article to being published too. Yeah, but we also accepted suggestions to share our experience, of course.
Okay, thank you so much. And thank you, John, for sharing. We are rapidly coming to the end of our time. I think maybe we'll just take one more of the questions that I have here in the Q&A. And there are some more specific questions relating to the IPC training that Briëtte is running. And I think I will ask Briëtte to post those on a separate site that we have set up, and I'll mention just a moment. But just very quickly to touch on this one about overcoming cultural challenges and how we do that with the courses that we're running. How do we foster cultural sensitivity in the trainings that we were running? So I can speak a little bit about it in terms of the MOOC, and it was very much about adopting this social constructivist approach, which says, you know, everyone's thoughts, opinions are valid, and really encouraging people to share their different experiences and to learn from the different things that are shared. And lastly, trying to bring as many contributors from across the globe as possible so that you have a diverse offering initially, as well as encouraging sharing of and learning from from lots of different perspectives. I'll leave it there. Do you want to add anything, Briëtte or Renata, to that?
Yes, Maryirene, I think it is important, like our training, we often go to a country and then conduct training in that specific country based on a need. And I think it is extremely important that you take the culture and the beliefs of the country in consideration, that you don't go with your own perceptions and ideas, but that you actually listen to the people and know, you know, how they believe and or what they believe and how they experience things. And often it is necessary to sit down with the people. And as I said in my presentation as well, the leaders of communities, and sit down with them and understand how they think and what they believe.
I will, because of the time, sadly, the hour goes by so fast. I need to wrap things up. But it's really to say that we can continue the discussions we have started here through an online discussion page that has been set up. And I believe the link to that page is going to be going in the chat now, if it already hasn't. If you go to the UK PHRST Knowledge Hub page, using the link that's been posted in the chat, you will find a page that will encourage you to continue to share resources, ideas, and questions. And what we're going to do is we'll take the questions that were left over from the Q&A here, and we'll post it there and also give as many responses as we can in the text there. As mentioned earlier, we aim for this to be the first in a series of similar discussions, with each discussion focusing on different topics relating to disease outbreak preparedness and response. We will now share another poll with just 2 quick questions to let us know if the event did provide the opportunities for sharing of ideas, and if there is interest in a future session like this. Zainab, please, could you share the poll? Lovely. So if you could quickly give your responses to the poll, that would be great. I can see lots of responses coming in. If anyone hasn't had a chance, if you can just give your quick responses to the poll, and then we will wrap. I think we're at time, Zainab, so we can share that response now. So it's great to see that you felt that this did give the opportunity to share experiences. I feel we didn't quite have enough time, but we will hopefully adjust things so we can have more time in the future. Lastly, just to close by saying, if you have ideas for a topic for a future discussion, please feel free to post them in the chat, and also to email the uk-phrst@lshtm.ac.uk. That email address is going in the chat just now. So if you have ideas for future sessions, please feel free to email them to that address, and we'll be in touch. And equally, if you would like to be a speaker on a future event, please do feel free to email your suggestion, and we will be in touch. Lastly, all that's left to say is thank you so much for joining us for this event, and a big thank you to our speakers, Renata and Briëtte, and I look forward to having further discussions with you online or on another webinar, and all the best. Thank you so much.